So this is the budget change proposal, HQ02, which is the timely investigation of caregivers. A little bit of background, in 14-15, CHCQ received 18 limited term positions to address complaints against certified caregivers more timely and to resolve the large number of pending complaints that we had. These are complaints against certified caregivers, certified nurse assistants, home health aides, and certified hemodialysis technicians. So this proposal will convert 18 limited term positions to permanent and add 2 attorney positions to the department's Office of Legal Services. The 18 positions will continue to support the progress the limited term positions have made towards A, resolving the number of aging cases, and B, addressing new complaints more timely. The 2 attorneys, one is a litigation support attorney, which will provide support in administrative appeal hearings. This attorney will prepare for and testify at these hearings and address administrative law judges' concerns about DPH being represented by analysts at these hearings. And these positions will provide legal expertise to the professional certification branch in preparing pre- and post-hearing briefs and will appear and represent public health in these hearings. There's also a House Counsel position, which will assist the professional certification branch in interpreting the complex federal regulations related to requirements for professional staff and assist in developing regulations.
With this additional personnel, how long do you think it will take you to bring down your roughly 700 open complaints over the last 2 fiscal years?
So I believe that we will have them, so there will always be some number of pending complaints, but we'll be at a place where there's not a tremendous number of aging complaints by the end of 17-18.
Any questions, colleagues? LAO, Finance? Thank you. We'll move on to the last issue under licensing and certification, which is licensing fees, issue 9.
So in 16-17, CHCQ proposes to increase fees by a cap of 40% on facilities that would see an increase in their fees as a share of their workload. These fee increases are necessary as a result of the positions that were granted in the 2015 Budget Act.
Any questions, colleagues? Senator Stone.
As I look at the fees and the proposed fees, am I correct in saying that these are roughly 40% increases across the board?
That is correct. There's, I believe, 40% fee increases on all but a handful of facilities.
Yeah, so I mean, that's raised for concern for me at a time when healthcare costs seem to be increasing rather than decreasing. What kind of efficiencies have you tried to implement and streamline operations? How do you explain to these people we're going to see a 40% increase? Many of these are Medi-Cal providers that we just gave a little relief to, but it seems like we give with one hand and take with another. How do you respond to 40%?
So our fees are follow on to our November estimate every year. So we in some sense, zero base our budget and then our fees each year. And we estimate the workload and then the number of staff that are needed to do the workload. And then based on what it costs to provide those services, we pass the fees on to the facilities. There were a number of years where there were no fee increases, and in fact, in some recent years, we even had some reductions in fees. Last year, we had a fee increase for the first time in a number of years as part of the augmentation of 237 new positions granted by the legislature last year, and this is a follow-on to that.
I still think it's pretty alarming, and I would suggest and opine that you should, if you're going to look for a fee increase like this, that it should be phased in over a number of years, because I think you're going to be hurting a lot of these agencies. 40%, I mean, that's just outlandish.
LAO? Finance? Before I open it up to public comment, I just wanted to go back very quickly to the overview. Page 27, there's a comment under the staff comment recommendation that talks about the long-term care ombudsman program and what we did last year. How's the program going? How was that investment used? I see you didn't come back this year asking for additional resources, but I'm just curious about how that's been implemented?
The Ombudsman program is separate from the California Department of Public Health. It's housed out of the California Department of Aging.
Got you. All right, thank you. And LAO Finance, no comment on all those issues for license certification? Great, we'll open up for public comment. We ask everyone to limit their comments to 2 minutes per. And I'll fudge if you need to go beyond as we hit multiple issues. Before I open it up, Senator Stone.
I just had the previous question a while ago about the lead-based issues. I don't know if this is the appropriate time to bring that up.
No, because that's issue 12.
That's still coming up? Okay.
It's coming up.
All right, just want to be sure.
It's page 38 on the agenda. We're coming.
Okay.
I'm getting there as fast as I can, Senator Stone.
You're doing great.
Thank you. Mr. Arnold.
Thank you, Madam Chairman and members. Michael Arnold, representing the California Dialysis Council. Our organization has been very supportive of licensing and certification over the years. Pardon me. And we strongly supported budget requests over the past couple of years for additional staff members. We have a big problem having to do with licensure and certification of new dialysis clinics. New dialysis clinics are waiting 12 months for licensure and certification. And what we need to realize is that many dialysis clinics are at capacity or beyond capacity. Many dialysis clinics have started what is known as a fourth shift, so the patients don't start until 9 o'clock or so at night. That is not good for the patients because they don't get off until 1 or 2 in the morning. These are patients that have to have dialysis 3 times a week, 3 hours a day. So, and if a patient is on a fourth shift and that sort of thing and has to drive by a dialysis clinic that is awaiting licensure and certification, that's really not good for anyone. And there are a lot of other issues that I won't get into right now, but if there's anything that could be done to speed up state licensure and Medicare certification for dialysis clinics, we think that would certainly be in the best interests of the dialysis patients of this state. So thank you.
Thank you. Tragically, given the number of younger people that are requiring dialysis, I have a couple of constituents who are opting for that shift because they're young enough to still work, quite frankly. But I understand your point about that not having to be required just because there's no capacity. Next witness, please.
Good afternoon, Christina Romero, Planned Parenthood Affiliates of California. I'm first going to comment on issue 7, program quality improvement projects. We strongly support DPH's proposal to redesign the CAU's IT systems, which would move the healthy facility licensure application process away from the paper-based process currently in place. DHCS recently moved its Medi-Cal enrollment process to an online system called PAVE. Their transition from paper applications to web-based application was very thoughtful and transparent, and they relied heavily on stakeholder improvement and feedback. So we'd encourage DPH to likewise involve stakeholders in the process. Healthcare facilities can offer a unique perspective to the application process, which will help DPH build the best electronic licensure system possible. With regard to issue 9 under licensing fees, we would agree with Senator Stone. We definitely take issue with a 40% increase. It's of great concern to us, and we'd especially like to just point out that the 40% increase on community clinics is especially burdensome, considering the all-time low Medi-Cal reimbursement rates that we're experiencing and already struggling to adequately serve all of our patients. Thanks so much.
Good afternoon, Madam Chair, Senators Stone and Monning. I'm Joe Rodriguez, the California State Long-Term Care Ombudsman. I'd like to recognize the department for the progress that we've heard about this morning. I meet with the department on a regular basis, both here in Sacramento and with the Los Angeles County office, and I'm encouraged by the progress that they're making. It's a good sign. I'd also like to say to Senator Mitchell, thank you for your support and for the committee's support last year in the funding augmentation that we received. We've been able to hire additional staff and local programs. We're hoping we can use that to leverage additional volunteer ombudsman representatives. We are seeing an increase in visits. We are seeing an increase in complaints. And I want to recognize and agree with the consultant's recommendation in the report. Ongoing ombudsman presence in facilities means an improvement of quality of care and quality of life for residents. We're able to keep complaints out of the more costly regulatory system because we're able to resolve them faster on behalf of residents. And that's what we are. We're problem solvers. We're able to resolve or partially resolve 75% of all complaints brought to us. Last year alone, more than 40,000 complaints were handled by the State Ombudsman Program. Thank you for the recommendation to consider another year of one-time only money to the program. If there's any way that the committee can see fit to make that permanent from whatever source you find appropriate, it would go a long way in strengthening and stabilizing this program. Thank you.
Thank you. Next witness.
Selena Pryor with SEIU Local 1000, and I just wanted to address issue number 8. We are supportive of the department's request for to make the limited term positions permanent, and we see this as an important and necessary step to increase protections for the most vulnerable population. Thank you.
Thank you.
Good morning, afternoon. Michelle Cabrera with SEIU California. We represent both the LA County licensing and certification workers as well as the state nurses who do the licensing and certification work. And I want to thank both the department as well as this committee for the attention, but in particular, the department has really invested a lot of time in taking what was a program that had been, hard hit, whittled down to the bare bones and turning it around. Change really does start at the top, and we want to thank the department, we want to thank this committee, and just encourage this ongoing continued effort and oversight so that we can get the program where it needs to be. It is a process. It will take time. I think we said that last year in our advocacy because recruitment has been a challenge, and we need to build the ship while we're sailing it. So we appreciate any questions. We can follow up on some of the questions Senator Stone had about Los Angeles, but thank you so much, and thank you.
Thank you. Next witness.
Good afternoon. I'm Lisa Coleman with CalCOA, the Long-Term Care Ombudsman Association, and I'm excited to be here a year after last year when we were having hearings, and it's encouraging to see the progress that DPH has made in that year. And the Ombudsman, we also experienced progress, and I'm happy to report some of the improvements we've experienced from the funding that we received just six months ago. Using the information that was provided from the annual report, CDPH received 6,732 complaints in skilled nursing facilities statewide. The Ombudsman's investigated 25,802 complaints in nursing homes statewide. Now, because the LA County program, the contract was a big part of the discussion, I thought I would share just a little bit of the success that the Ombudsman program is experiencing in that particular area. In this last fiscal year, the LA County program investigated 10,220 complaints. Of that, 7,326 complaints were investigated in skilled nursing facilities. They were so successful in their complaint investigation that only 189 of those complaints had to be referred to the Department of Public Health. When you're looking at the entirety of the Department of Public Health and having nearly 32,000 deficiencies that they issued last year, almost half of those 14,000 deficiencies occurred in skilled nursing facilities. A big part of the role of the Ombudsman is in skilled nursing facilities. So we are very, we graciously ask and thank the consultant that the one-time money, the $1 million, be issued again. We respectfully ask that it move from a one-time only into an ongoing appropriations. It's very difficult to purchase staffing. It's difficult to set plans when you're looking at $1 million out of the $7 million of our budget is only one-time money. We made progress. One of the key components of the indicators of progress for the Ombudsman program is unannounced quarterly visits in facilities. Of the 1,251 skilled nursing facilities that we have in the state of California, 850 of them received an unannounced quarterly visit in the first quarter of this fiscal year. And that's a great improvement, but that still leaves over 400 nursing homes that didn't have our benefit of the Ombudsman's presence. So I ask that the $1 million be made permanent, but also that you would give consideration to increasing the funding in whatever means you find appropriate. Thank you.
Thank you very much. Next witness, please.
Good afternoon, Madam Chair and Senators. My name is Aaron Lewis for the Consumer Federation of California, and I just joined with the previous comments and wanted to register our strong support for the committee staff recommendation for the augmentation to the long-term care ombudsman's office, and would urge that it be a continuous appropriation as well. Thank you very much.
Next witness, please.
To move this down for little old me. Hi, I'm Krista Chelamides from Senior Advocacy Services. We're Ombudsman and High Cap for Sonoma County. And I, first of all, just wanted to thank you for the $1 million and drill it down for you about how on a local level this really was impactful. Our county received about $12,000 of that $1 million, and I was able to leverage that money to train 14 new volunteers. Of these 14 volunteers, if you count the hours that they return, in 4 months they paid back that. If it was only $15 an hour, these people are very, very effective. I can make $1 out of a dime, but I can't make $1 out of nothing. So I hope that you guys will consider making this a permanent appropriation. Thank you.
Thank you. Next witness.
Good afternoon. Thank you, Madam Chair and Senators. This is Mark Vittoria. I'm with ASME Local 2620. We represent licensing program analysts that are out in the field inspecting other facilities such as RCFEs, residential care facilities for the elderly, and adult daycare programs. We work side by sides with the Ombudsman programs. We're just here standing in support of any augmentation that you guys have for continued support of the long-term care program there. Thank you.
Thank you.
Hi, I'm Nancy Murish with the Congress of California Seniors, and as we did last year, we are supporting additional funding for the long-term care ombudsman, and our organization is, this is one of our top 3 budget priorities. We feel it's very important. Thank you.
Thank you. Final witness.
Carol Sewell from the California Commission on Aging. The Commission is in strong support of the request for the additional $1 million from the citation penalties account for the long-term care ombudsman. We feel that this would be a very appropriate ongoing use of those funds if the citation penalties account exists in order to protect residents. This is a great way to do it on an almost daily basis with the volunteers. So thank you for your consideration.
Thank you, and thank you for your presentations today. Appreciate your time. Colleagues, we're still under item 4265, Department of Public Health. Moving on now to issue 10, Proposition 99, the California Tobacco Health Protection Act of 1988. I was actually here as a staff member. Jeez. Page 35 of the agenda, please.
Good morning, Madam Chair, Senators Monning and Stone. I'm Mark Starr, the Acting Deputy Director for the Center for Chronic Disease Prevention and Health Promotion in the Department of Public Health. And I have with me Mr. Greg Oliva, who's our Assistant Deputy, and I think you met him earlier. The mission of our Center for Chronic Disease Prevention and Health Promotion is to prevent and control chronic diseases. No surprise there. We address many specific diseases, things like cancer, cardiovascular disease, diabetes, but we also endeavor to prevent and control diseases through behavioral risk factors, environmental factors, and occupational factors. So to that end, our budget proposals this year promote and support safe and healthy communities and environments. And we also have a proposed spending plan for the projected increases in Proposition 99 funds for activities related to tobacco use and its health impacts. So we'll start with the Prop 99 issue that you mentioned, Madam Chair, and then we'll go into the other 3 budget proposals. The write-ups in the agenda are excellent. Mr. Oliva will provide an overview of each of the proposals, and we'll address specific questions, and we will definitely get to Senator Stone's question about our lead program.
Thank you, Dr. Starr. Greg Oliva, glad to be back. So the first one, Proposition 99, we're here today. We appreciate that this item's being held open because these are estimates of revenue based upon the January budget, and we'll do that again in May. So we appreciate that. We're very enthusiastic about the revenues and what we would like to propose to spend them on. In the health education account, the $4,194,000. And just to provide you a little bit more detail on how we intend to spend those dollars, the largest would be for our media campaign, $1,916,000. And what we would do with that is to expand and extend our ability to communicate the services available via the California Smokers Helpline, so to encourage cessation of current smokers within the state, and to also extend the reach of our existing e-cigarette media campaign. So those would be the two primary purposes of that increase in dollars. The second largest component would be for the local lead agencies. And the local lead agencies are provided funds via an allocation formula in statute. So the increase corresponds to calculations that we use to give additional funds to the counties. Every county is considered a base county, and then based upon population statistics at the time of the initiative gets additional funds. So as a result of the $1.418 million, we would be able to provide additional funding to Fresno, Los Angeles, Orange, Riverside, Sacramento, San Bernardino, San Diego, San Francisco, Santa Clara, and Sonoma. And 4 of those counties that are currently base, receiving only $150,000, would have their allocations increased. So that's and the counties are responsible for doing comprehensive tobacco control work in their communities. The third largest component would be for our evaluation efforts, and that's $410,000. And we'd primarily use that to expand our mapping capabilities to identify hotspots, if you will, of where youth might be more exposed to easier access to tobacco products throughout the state. And we'd also like to look into doing a little bit more surveillance related to e-cigarette use. So those would be the largest functions of those funds. We would also ask for $250,000 in the competitive grant line item, and we would use those funds to support efforts that we're conducting on better using electronic health records to communicate between health providers and our California Smokers Helpline, so that there's real-time communication between the healthcare community and the helpline to be able to do proactive messaging to those particular smokers once they visit the doctor's office. And we've piloted this a little bit with UC San Diego and also a few health plans down in Southern California. So we'd like to expand on that. And then also to do some more material creation for a campaign that we work on in creating healthy stores in healthy communities and looking at the amount of tobacco. And it's a collaborative effort with other programs within our center that look at nutrition and then also alcohol. So some more materials development in that area. Finally, a little chunk for support to be able to provide some oversight to these wide variety of activities, and that we're asking for $200,000 in state administration. So we're really happy about our program and what the success that it's achieved in the since 1988 in reducing smoking by about half in the state, and these funds will really help to continue that progress.
The 1.9 for the media campaign, an increase in a current funding level, or is that the funding for the media campaign for this year?
It would be an increase to the current funding level.
Bringing it to a total of what for the fiscal year?
I would have to get that back to you.
Okay, you let me know.
In the neighborhood of probably $13.5 million.
Thank you. Senator Monti.
And if I could point out, so the revenue estimates change every year, so the 1.9 million would not establish a new baseline necessarily for the account. So, and media is a very effective way to spend funds quickly and provide a lot of outreach.
Senator Monti.
Thank you. I'm just curious, the reference to e-cigarettes, from a public health point of view, how do you see that affecting progress that's been made in education and tobacco cessation, and particularly, will this be adequate to counter some of the advertising that's targeted young people with e-cigarette products?
So we see it as a pretty significant danger to the progress that's been made over the past 25 years with the tobacco control movement within the state. The data that we're seeing finds, and the evidence that we're seeing finds that it can serve as a gateway product to actual cigarette smoking. And e-cigarette use is actually, we're identifying it as 2 to 3 times higher than cigarette use within high school populations, youth populations. So, and it's very hard to distinguish publicly the difference between e-cigarettes and cigarettes in their use. And there's a lot of vagueness in terms of where they're acceptable and where they're not. So we think it's a significant danger to the progress, and that's why we initiated the campaign.
And in the campaign to young people, who designs that advertising outreach or that public information outreach?
So we have a advertising agency named Duncan Shannon. They're based in San Francisco, and they were the agency that created the ads that I hope you've all seen in 2015. The lollipop, and then the other ad, and they were awarded through a competitive process a few years back to be our advertising agency. They actually won an award last year in that the healthcare community provides to various public impact campaigns.
Is there any effort to reach icons in the entertainment or sports industries to participate in that outreach? Because I think some of it, no matter how creative and dynamic, young people aren't influenced by health advertising on TV necessarily. Is there any conscious effort, or can you, in engaging these PR companies, make a conscious, intentional outreach to some that will have more impact on these kids if they hear them denouncing the adverse health impacts of these products?
That's a great question, and we have done that historically, and we've actually had some mixed results because we have identified, particularly, I will not name names, but we've identified individuals who would be a good demographic to impact smokeless tobacco use. And then a year or two later, they turned out to be proponents of those particular products. So I appreciate the reach and the potential that would have as a strategy, but it also, in our experience, created a risk.
Right. Well, I wasn't aware of that, but it's somebody comes along offering a lucrative contract. That's obviously alluring. But it'd be great to create a firewall of unacceptability of these products and try to enlist a broad base of public figures who would sign on, maybe passing a baton of support, something like that. But anyway, without getting into the details, it's a huge problem, I think, and we have to be creative and enlist young people's thought processes in terms of what is going to be effective. Thank you.
Thank you. What we really tried to accomplish in the campaign this last year was to impact healthcare professionals, because it's often proposed and as a cessation product. So we wanted to reach the healthcare community to talk about, what the best evidence and science related to what are effective and FDA-approved cessation products, in addition to parents, because a lot of these products really, there's a lack of kind of prominence and evidence even in the environment of the home as to someone's actually smoking one of these, because they look innocuous, they're not as scented as a tobacco product. So that was some of the initial outreach.
Yeah, and I appreciate that focus. I know in a lot of the hearings we had on e-cigarettes, a lot of the proponents argued just what you suggested. Well, it's a cessation product, but they've already been hooked on nicotine, however they got there, and this is just an earlier pathway to getting kids hooked on nicotine. So thank you for your efforts on that. Thank you, Madam Chair.
You have to tell you, Senator Monty, I'm so old and such a square, because I just hadn't seen one up close until this weekend at the State Dem Party Convention in San Jose, and right across the street from the convention center was a rave. So I got to see, I didn't go in, but I got to see, because I'm sure they wouldn't have let me, the young people coming in and out of the rave, and everybody had one in their hand. I was struck.
So you're not part of the rave caucus?